Hello. Today we are covering a presentation called AUR Module Value Set Resources. My name is Amy Webb, and I'm here with my colleague Laura Blum. We are part of the NHSN Antimicrobial Use and Resistance Module team, and we got significant support from our colleague Sheila Abner as part of the NHSN Informatics team on the slides today. Next slide, please. So after watching this session, you'll be able to describe the antimicrobial use and resistance, or AUR module value set resources provided by NHSN, determine the purpose of each value set resource and how they apply to the AUR module data, and determine where to find those updates to the AUR value set resources. Please. So our intended audience for this presentation is those folks that are involved with or responsible for AUR module implementation, maintenance, and perhaps those that are using the advanced analysis of AUR data. So that might include hospital pharmacists, infection preventionists, informaticists, or information technology or IT professionals, software vendors, and some NHSN group users, like at the health system level. Next slide, please. Okay, so let's get into some of the basics first. So what is a value set and how is that different from a code system? So a value set, as defined by the Value Set Authority Center, or VSAC, is a set of terms and corresponding codes for one or more code systems that define clinical concepts to support effective and interoperable health information exchange. So a couple examples we have here that relate to the AUR module reporting are our lists of organisms and our list of antimicrobials. Those are value sets. Separately, a code system is a collection of concepts or ideas with unique identifiers that exist in some sort of structure. So our examples for the AUR terms would be SNOMED CT as well as LOINC. Please. So NHSN uses both value sets and code systems, and we use value sets from various code systems. So on my slide here, I have just some examples. So we use SNOMED CT, we get our organism or pathogen codes from that system. We use RX norm specifically for the antimicrobials. We use LOINC for antimicrobial susceptibility tests. And then we also use HSLOC and CDC NHSN codes, which are for NHSN location codes, as well as specific AU routes of administration. And those two systems are proprietary code systems that are created by NHSN. And more, obviously, that we won't have time to cover in today's presentation that are used throughout the rest of NHSN. But today, again, we're highlighting just those value sets and code systems used by the AUR module. Next slide, please. Okay, so how does NHSN use value sets? So we create a list of what is eligible to be reported. Then each item in the list has a specific code used to represent that entity. Then the codes from those value sets are used in the clinical document architecture, or CDA, files to report data to NHSN. So let's walk through an example listed on the bottom of this slide. So we have our list of antimicrobials that are reported for the AU option. Each of those antimicrobials is assigned a corresponding RX norm ingredient level code for the most part. And those RX norm codes are used in the AU CDA file for reporting your AU data to NHSN. Next slide, please. So how do facilities and vendors use NHSN value sets? So from your side, you would review the NHSN prescribed value sets. You would look at your facility level data to determine what code system is being used internally. Are you using a terminology standard like SNOMED CT, LOINC, RX norm, et cetera? Or perhaps you're using local codes created by your facility. Then you would need to map the codes that are used by your facility to those codes specified by NHSN. Now that mapping process can be completed either by someone at the facility or at the vendor level. So that's between you and your vendor who is in charge of that mapping. And lastly, plan for yearly updates and or checks of the changes to our value sets. So as I mentioned, we are going to focus solely on the AUR module value sets listed on this slide. So for AU option, that includes our antimicrobials and our routes of administration. And for the AR option, that includes pathogens, specimens, and antimicrobial susceptibility panels. And those panels are made up of a group of susceptibility tests. Next slide, please. Okay, so some of what we're going to show you today includes the NHSN IDM. So a little bit more about the IDM. The IDM stands for the Information Data Model. It contains information on value sets, variables and data elements, and business rules used by NHSN. So it's important to remember that different folks have different uses for the IDM. So NHSN developers, of course, will use all IDM content, whereas software vendors might just use a smaller subset of the content, and hospitals and health systems may use an even smaller subset of the content compared to vendors. Next slide, please. So the IDMs are updated according to the changes that occur in each NHSN release. In general, a green cell indicates that there was a change in that cell from the previous NHSN release. The first two columns in most of the tabs include the NHSN version number and associated change request, CR, or the defect for that change. And you can find the IDM on the CDA toolkits page that we've linked here. Please. Okay, and now I'm going to turn it over to my colleague, Laura. Thank you.
Thanks, Amy. I'm going to start off talking about some of the AU option value sets, and we're going to talk about the AU option antimicrobials. So currently there are 96 antimicrobials eligible for 2024 AU option reporting. CDA files that are submitted to NHSN must include all of these antimicrobials with a value of a specific number, 0 or NA, not applicable. There's a list available in the Antimicrobial Ingredients 2024 tab in the IDM that has all of the eligible antimicrobials. The IDM is included in the AU and AR toolkits, which can be found on the NHSN CDA submission support portal, like Amy mentioned, just linked here. So let's go over the Antimicrobial Ingredients tab in the IDM. The code column is a local mnemonic created by NHSN, which is currently used in NHSN analysis reports. The display name is the abbreviated and full name of the antimicrobial as they appear in NHSN. The value set AURPH column indicates whether or not the antimicrobial is eligible for AU option reporting. If there's an X in this column, that indicates that the antimicrobial is eligible for AU option reporting. The value column is the RX norm code reported to NHSN for the antimicrobial. The code system column is the object identifier, or OID, used for RX norm codes in the CDA file. So this will always be the same generally, since all of the codes are in RX norm. And like Amy mentioned with the IDM, changes since the previous version of the IDM are highlighted in green. So in this example, gemafloxacin is highlighted in green. And we can see that there is not an X in the value set AURPH column. So that means that gemafloxacin is no longer eligible for reporting to the AU option, and that'll be removed in the next version of the IDM. So we have another way to look at the eligible AU option antimicrobials, and that's the list of antimicrobial agents eligible for the AUR module. That can be found on the AUR module website under supporting materials. Link that here. So this is our list of antimicrobial agents eligible for the AUR module spreadsheet. The AU Antimicrobial Agents tab contains a comprehensive list of all antimicrobials that were ever eligible for AU option reporting. And the spreadsheet may be a little bit easier to read and understand than the IDM for some users. So going over the spreadsheet, the antimicrobial agent column is the name of the antimicrobial as it appears in NHSN. The antimicrobial category is going to be either antibacterial, antifungal, antiviral, anti-influenza, or monoclonal antibody. Then we also have the antimicrobial class and antimicrobial subclass. The value column is the RX norm code reported to NHSN for the antimicrobial. The NHSN drug code column is a local mnemonic created by NHSN, which is currently used in NHSN analysis reports. The first reported column is the first date that the antimicrobial can be submitted to the AU option. So when it was added, which would either be at the beginning of when the AU option was created or later on, depending on the drug. The last reported column is the last date the antimicrobial can be submitted to the AU option for antimicrobials that have been removed. And then the notes column has any relevant information for reporting each antimicrobial. So we have a color coding system in the spreadsheet. Antimicrobials that were added since the AU option was created are highlighted in teal. Antimicrobials with changes to their RX norm codes are highlighted in purple. And removed antimicrobials are highlighted in orange. So in our example here, we can say that amikacin liposomal was added since the AU option was created. It was added in October 2018, if we look at the first reported column. Amphotericin B lipid complex had a change to its RX norm code. So that's highlighted in purple. And then we have a little note in the notes column here that says not a new drug, but added due to a change in the RX norm coding. And then ceftotorin at the bottom here was removed. It's highlighted in orange. And we can look at the last reported column and see that it was removed in December 2019. So now let's go over the AU option routes of administration. The AU option accepts 4 routes of administration, and those are intravenous or IV, intramuscular or IM, digestive, and respiratory. The route codes are listed at the bottom of the Denom AU tab in the IDM, and there's only one code accepted for each route. So we only have 4 route of administration codes that are accepted at this time. And if you scroll all the way to the bottom of the Denom AU tab, that's where they're located. So some notes about these route codes. The digestive and respiratory route codes are from the CDC NHSN code system. The IV and IM route codes are SNOMED CT codes. So we have a mix of 2 different code systems in this value set. Since many concepts can represent IV, IM, digestive, and respiratory antimicrobial administrations, we have another spreadsheet that can sort of help you roll up these concepts into the accepted routes of administration. And just a note that interpleural administrations are not eligible for AU option reporting and should be excluded from respiratory administrations. Our suggested roll-up to the 4 accepted routes of administration codes is included in the SNOMED CT AU routes of administration spreadsheet, which is in the AU toolkit. So going over the spreadsheet a little bit, the value accepted by the AUIG column is the code that gets reported to NHSN. These are those 4 codes that are accepted by NHSN. The SNOMED CT routes included within substratified route type column is the suggested concepts to roll up to the accepted codes, if there are any. The SNOMED CT CID column is the SNOMED CT codes for the suggested concepts that would get rolled up if applicable. Now let's move on to looking at the AR option pathogens. So all pathogen codes accepted by the NHSN application are listed in the Pathogen Codes 2024 tab in the IDM. And the pathogen codes that are eligible for AR option reporting have an X in the ARO pathogen column. The Pathogen Codes 2024 synonym tab is not used for AR option reporting, so we're not going to go over it in this presentation. And just to note, all the screenshots of the IDM have some columns hidden, so you're able to see everything better. It's quite a long spreadsheet. Going over some of the columns in the IDM, the description for dropdown in app column is the name of the pathogen as it appears in NHSN. The new code column is a local mnemonic created by NHSN, which is currently used in NHSN analysis reports. We also have the SNOMED preferred term and SNOMED fully specified name in this tab. The SCTID US edition 2021-09 column is a SNOMED CT code for the pathogen from the previous calendar year for reference. So we don't currently use this column in the NHSN app. It's just we provide the older edition for your reference. So the SCTID US edition 2022-09 column is the one that's currently used. This is the SNOMED CT code currently accepted by the NHSN application. And the dates for both of these indicate the version of the SNOMED CT United States edition that's used. So for the currently accepted codes in the app, use the 2022-0901 United States edition of SNOMED CT. The sort column is just a column that you can use to sort by genus, species, and subspecies within this tab if you want to. Sorting alphabetically would kind of lose some of the meaning, so we provided this column as well. The planned version is the version of NHSN the pathogen was added in if it's new. The defect CR column is the defect or change request that added the pathogen to the NHSN application if it's new. Changes since the previous version of the IDM are highlighted in orange on this tab. One example here is Citrobacter brachii. Just the ARO pathogen column is highlighted for that pathogen because it was newly added as an eligible AR option pathogen this year. So the change type column in this tab indicates the type of change made since the previous version of the IDM, if there was a change. None in this column means there was no change. Update means there was an update made to the cell highlighted in orange. Add means it's a new pathogen that was added. And an activate means the pathogen was removed. So we can look here for our example for Citrobacter brachii. Like we said, it was added as an eligible AR option pathogen. We can go look at the change type column. See that says update, which means there was an update made to the cell highlighted in orange, which is just the ARO pathogen column. So like we said, we can tell that it was added as an ARO pathogen. So advances in technology continue to allow labs to identify and classify pathogens at a more granular level, and SNOMED CT continues to add new concepts all the time. The NHSN AUR team decided to expand the list of eligible AR option pathogens to better capture the identification of specific pathogens. The AR option pathogen roll-up workbook included in the AR toolkit is how we do this. And we've also included a quick reference guide for the AR option pathogen roll-up workbook in the AR toolkit. So the AR option pathogen roll-up workbook is an expanded list of pathogen codes accepted by the AR option, and these are listed in the 2024 mapping tab. This workbook must be used to determine if a pathogen is eligible for submission to the AR option and whether that pathogen needs to be rolled up to a higher level concept to be accepted into the NHSN application. So going over the columns in the AR option pathogen roll-up workbook, the SNOMED CT code 2022-09. This is the SNOMED CT code for concepts eligible for AR option reporting. SNOMED CT fully specified name. This is the name of concepts eligible for AR option reporting. The concepts listed in these columns may or may not need to be rolled up to another SNOMED CT code to be accepted by the NHSN application. So the AR option accepts more pathogens than the NHSN application itself. The MAP2 code column, this is the SNOMED CT code that a pathogen should be mapped to and reported as to NHSN. A code in column B, or the MAP2 code column, should be rolled up. In column B. The code in column B should be rolled up and reported as the code in column D, which is the MAP2 code column. NA indicates the code does not need to be rolled up and can be reported as the code in column B. So if there's a code in the MAP2 code column, then the concept needs to be rolled up. If it says NA, it does not need to be rolled up. The sort column, similar to the IDM, is a column that you can use to sort by genus, species, and subspecies. And then the MAP2 name column is just the name of the corresponding code in column D, or the MAP2 code column, to improve human readability of the spreadsheet. And NA in this column similarly indicates the code does not need to be rolled up. If we take a look at the revision history tab, this just indicates the changes made to the workbook throughout the years and the rationale behind the changes. The date column indicates the date that the changes took effect. So if you want to know when a certain change took effect, you would take a look at this tab. So let's work through some examples with the pathogen roll-up workbook, because I know it can be a little bit confusing. So suppose we want to report antimicrobial susceptibility test results for an isolate with multi-drug resistant Acinetobacter identified. Multi-drug resistant Acinetobacter has NA in the MAP2 code and MAP2 name columns in the pathogen roll-up workbook. So that means that the SNOMED CT code for multi-drug resistant Acinetobacter can be reported to NHSN as is and does not need to be rolled up. Just a note about additional pathogen roll-ups that the NHSN application does automatically. NHSN application will automatically roll up some pathogen codes for you. Information about additional pathogen roll-ups are listed in the anti-P tab in the IDM, which we will go over later in this presentation. So for example, multi-drug resistant Acinetobacter, which is the code that we just talked about, is accepted by NHSN. However, immediately when you upload a file with this pathogen, NHSN rolls it up to just Acinetobacter. So let's go over another example with the AR option pathogen roll-up workbook. Suppose we want to report antimicrobial susceptibility test results for an isolate with asaccharidotic Acinetobacter identified. Asaccharidotic Acinetobacter has values in the MAP2 code and MAP2 name columns. You can see in the screenshot at the bottom there. So that means that the SNOMED CT code for asaccharidotic Acinetobacter is not accepted by the NHSN application and needs to be rolled up to the code for genus Acinetobacter to be reported to NHSN. Now I'm going to hand it back over to Amy.
Thanks, Laura. So now we're going to get into the AR option specimens. Next slide, please. So our AR option specimens are listed in the IDM, specifically on the specimen source tab. So the AR option has 4 eligible groups of specimen types: blood, cerebrospinal fluid, which I'll refer to as CSF, lower respiratory, or LRI, and urine specimens. So as previously highlighted in the IDM tabs, an X means that it's eligible. So on the specimen source tab, we're specifically looking at column F, value set AR specimen source. So an X in that column means that the specimen is eligible for reporting. Okay, please. Columns I through L are the separate specimen types the separate of the 4 specimen types there. So LRI, or lower respiratory, blood, CSF, and urine. So again, an X in that given column, in this case for LRI, for example, means that that specimen type is in the LRI group or LIA bucket. So these buckets are used for applying the AR event deduplication rules. So there are reporting rules for the 1 per month or the 14-day rules that require you to know which bucket the specimen type is falling into. Next slide, please. And then columns C, D, and E are the NHSN code, which again is the local mnemonic created by NHSN and currently used in the analysis reports. The concept ID in column D is the SNOMED CT code, and the preferred term in column E is the full name of the specimen used in the application. Next slide, please. Okay. So now we're going to talk about the antimicrobial susceptibility tests, or also known as drug panels. Next slide, please. So each AR option pathogen or organism has a required set of antimicrobial susceptibility tests, aka the drug panel, that must be included in the AR event file. And some pathogens may have a specific panel for urine specimens. We have 13 different panels in total. So in order to figure out which tests are included in the AR event for specific organisms, you can look at the AUR protocol, specifically Appendix X, or you can review the IDM. Specifically, we're going to refer to the anti-P and the AR-AST 2024 tabs. Please. So first, let's cover the anti-P tab. So this tab in the IDM lists each accepted pathogen with the SNOMED CT code and the preferred term with its associated panel according to the specimen type. Now this tab underwent major cleanup in January 2024 to remove all reference to synonyms, pathogen synonyms, since as Laura mentioned, the AR option does not use the synonym terms, they only use the preferred terms. Next slide, please. So to orient you to the tab a little bit, starting with column C, we have the ARO pathogen category. So that lists the genus or species level term. In my screenshot here, you can see Acinetobacter as that category. The preferred term is the full name of the pathogen used in the application. So you can see different types of the Acinetobacter code. And next is the SNOMED CT ID, and this is just the SNOMED CT code for that given pathogen. That is the same SNOMED CT code that's in the pathogen codes tab of the IDM. And column F, the term type is, in this case, you should see all term type P or preferred term, meaning all of the synonyms, term type S, have been removed from this tab. Next slide, please. And you get some bonus information in this tab. So this tab also shows the SNOMED CT code for the preferred term that's accepted by NHSN and the SNOMED CT code and the name it'll be rolled up to. So in the example here in my red box, the top row, for carbapenem-resistant Acinetobacter, that code is accepted by NHSN. However, immediately upon upload, NHSN rolls it up to genus Acinetobacter, or the code that ends in 7008. So you get some extra information in this tab that can, again, help you with applying the deduplication logic. So mainly that's at the vendor side for the NHSN AR events. Next slide, please. So columns H through K on this tab lists a specific specimen type and the associated panel. So in this example, I'm showing just a few rows for Acinetobacter. And you can see that Acinetobacter specimens from urine actually use a separate drug panel, or the anti-P20UR, instead of the anti-P20, which is used by Acinetobacter specimens collected from blood, CSF, and lower respiratory. All of our urine panels will use the UR at the end of the panel name as the indicator that it's a urine panel. Next slide, please. Okay, so now let's switch gears and talk about the AR-AST 2024 tab. So it's a new tab in the IDM. This one lists the antimicrobial susceptibility tests that are required for each panel and the associated LOINC codes for each of those tests. Now, I want to point out that this tab, AR-AST 2024, is used only for reporting your AR option data. So it is not used for your HAI reporting. Each drug panel is associated with a column in this tab. Again, an X in the column means that that antimicrobial susceptibility test is required when reporting the given organism that uses that panel. Next slide, please. So walking through this tab a little bit more, so the value in column C is the LOINC code for the methodless susceptibility test. So we've made that choice that we are asking for methodless test codes. The code in column D is the local mnemonic code created by NHSN that's currently used in NHSN analysis reports. Next slide, please. Column E is the display name. This is the name that's displayed in analysis reports. And the code system is the OID used for LOINC codes, and that OID is really just used in the CDA file. Next slide, please. So then, column G, the value set AR drug code. So an X in that column means the susceptibility test is included in the value set in all of our panels. You'll use columns H through T to represent each of the 13 panels. So an X in column H through T means that that susceptibility test is included or required for that specific panel. So let's talk through an example here. So let's say I have an E. coli that is isolated from a urine specimen. So first, I'm going to use the anti-P tab to determine the panel number. And in this case, I'm going to go to the E. coli pathogen category. And I have just a regular E. coli. So I'm going to refer to row 127 in my IDM tab. I'm going to go over to the urine column, column K, and I can see that I need to use the ARO _ anti-P22UR panel for reporting this event. Next slide, please. So then I'm going to go, since we've used the anti-P tab to determine the panel, anti-P22UR. Next, I need to go to the AR-AST 2024 tab to determine the susceptibility tests that need to be included in that specific AR file. So I can filter on column L, or the column for anti-P22UR, to see only those drug tests with an X, meaning only those that are required. And I can see that there are 39 susceptibility tests that need to be included in my AR event file, regardless of whether they were reported by the lab. But as you know from your AR reporting trainings, even though the lab doesn't test it, that's okay. You can just report not tested. We do not expect your lab to test all 39 of the susceptibility tests. Next slide, please. Okay, so that concludes the bulk of our presentation. We wanted to highlight a few resources for you to put them all in one place. Next slide, please. So the NHSN CSSP, that stands for CDA Submission Support Portal. Specifically, there's a web page for implementation toolkits and resources linked here. So on that page at the very top, you'll find a section for AUR. You'll find the toolkits for AU and AR that contain all the information we talked about today, including the IDM and those extra workbooks. The list of antimicrobial eligible agents is linked on this slide. And then lastly, the AUR module protocol also contains a lot of really great helpful information, but is in a PDF format. Next slide, please. So thank you so much for listening in to the presentation today. For any questions or concerns you have, please feel free to reach out to us. So if you have SAMS access, you can submit a ticket via the ServiceNow portal. If you don't have SAMS access, no worries. Just send an email to the NHSN help desk at nhsn@cdc.gov. Thank you so much.